Eggs are a staple in many diets worldwide. They're nutritious, affordable, and easy to prepare, making them a go-to for breakfasts, snacks, and even as an ingredient in many dishes. However, did you know that eggs can interact with certain medications, potentially reducing their effectiveness or even causing unwanted side effects? Today, we're diving into 15 medications that you should be cautious about if you consume eggs regularly. We'll share real-life stories of people from various walks of life who experience these interactions, helping you understand how eggs can impact your health. Whether you're managing a chronic condition, recovering from an illness, or just want to be better informed, this video is for you. Are you ready? Number 15, Warfarin, blood thinner. Jane, a 65-year-old stroke survivor from Florida, noticed unusual bruising after starting Warfarin, a blood thinner. She loved her morning omelet, but her doctor explained that the vitamin K in egg yolks was affecting her medication. Once Jane reduced her egg intake, her blood levels stabilized and the bruising improved. Warfarin interacts with vitamin K, and it's important to watch out for foods that are high in it, like eggs, to maintain the effectiveness of the medication. Number 14, statins, cholesterol-lowering drugs. Mark, a 50-year-old from New York, was taking statins to lower his cholesterol but wasn't seeing the results he expected. He ate eggs daily, thinking they were a healthy choice. However, his doctor informed him that the cholesterol in eggs might be counteracting the statins. After reducing his egg consumption, Mark saw a significant drop in his cholesterol levels. Statins can interact with high cholesterol foods, so it's best to limit eggs when taking these medications. Number 13, Tetracycline, antibiotic. Sarah, a 22-year-old college student from California, was prescribed tetracycline for acne. Despite following her prescription, her acne didn't improve. Her dermatologist discovered that she was eating eggs for breakfast, which contain calcium that can bind to tetracycline, reducing its effectiveness. After switching to a different breakfast, Sarah's skin started to clear up. If you're taking tetracycline, avoid eggs and other calcium-rich foods to ensure the medication works effectively. Number 12, ciprofloxacin, antibiotic. Tom, a 34-year-old father from Texas, was on ciprofloxacin for a urinary tract infection. He kept up his habit of eating scrambled eggs, but his infection persisted. His doctor explained that calcium in eggs could interfere with the antibiotics absorption. After Tom stopped eating eggs during his treatment, the medication became more effective, and he recovered quickly. For antibiotics like ciprofloxacin, it's best to avoid calcium-rich foods like eggs. Number 11, levofloxacin antibiotic. Maria, a 40-year-old teacher from Illinois, was prescribed levofloxacin for a sinus infection. She loved having a boiled egg with her lunch, but her infection wasn't improving. Her doctor advised her to skip eggs while on levofloxacin, as calcium can reduce the drug's effectiveness. Within days of avoiding eggs, Maria's symptoms began to subside, showing how important it is to monitor your diet when taking certain antibiotics. Number 10, iron supplements. John, a 70-year-old retiree from Arizona, struggled with iron deficiency anemia. Despite taking iron supplements daily, his iron levels remained low. His doctor found out that John often ate eggs with his supplements, not realizing that compounds in eggs inhibit iron absorption. Once he stopped eating eggs around the time he took his supplements, John's iron levels improved. If you're on iron supplements, it's best to separate them from egg consumption. Number 9, bisphosphonates, osteoporosis medications. Linda, a 60-year-old woman from Ohio, was on bisphosphonates to strengthen her bones. She took her medication with a hard-boiled egg in the morning but didn't see the expected improvements in her bone density. Her doctor explained that calcium in eggs can interfere with bisphosphonates, and after changing her breakfast routine, Linda's bone density started to improve. To get the full benefits of osteoporosis medications, it's important to avoid eggs and other calcium-rich foods around dosing time. Number 8, levothyroxine, thyroid medication. Tim, a 45-year-old engineer from Pennsylvania, was taking levothyroxine for hypothyroidism. He often ate eggs with his breakfast right after taking his medication. Over time, he noticed that his symptoms weren't fully controlled. His endocrinologist advised him to take the medication on an empty stomach at least 30 minutes before eating and to avoid eggs during that period. Tim saw a significant improvement in his thyroid symptoms after making this adjustment. Number 7, calcium supplements. Michelle, a 55-year-old nurse from Michigan, took calcium supplements for her bones and regularly ate eggs for breakfast. Her doctor advised her to separate the timing of her calcium supplements and meals, especially eggs, to avoid interference with absorption. After adjusting her routine, Michelle noticed better results from her supplements, highlighting the importance of timing when combining supplements with your diet. Number 6, Antacids. David, a 38-year-old chef from Georgia, frequently used antacids for heartburn and ate eggs regularly. He didn't realize that antacids, especially those containing calcium, could reduce the effectiveness of his medications when taken too close to meals that include eggs. After adjusting the timing of his meals and antacids, David found better relief from his symptoms and his medications worked more effectively. Number 5, blood pressure medication. Susan, a 65-year-old retiree from North Carolina, was on an ACE inhibitor for high blood pressure. She enjoyed eating eggs a few times a week, but began to feel weak and lightheaded. Her doctor discovered that her potassium levels were elevated, partly due to her egg consumption. Once Susan reduced her egg intake, her potassium levels stabilized and she felt much better. If you're on blood pressure medications, monitor your diet for foods high in potassium like eggs. Number 4, diuretics, water pills. Carol, a 48-year-old teacher from Minnesota, was on a diuretic to manage fluid retention. She experienced frequent muscle cramps and fatigue, which her doctor linked to high potassium levels from her diet, including eggs. By cutting back on eggs, Carol was able to balance her potassium levels and reduce her symptoms. Diuretics can alter your electrolyte balance, so it's crucial to manage your intake of potassium-rich foods. Number 3, digoxin, heart medication. Alan, a 72-year-old artist from Colorado, was on digoxin for heart failure. He enjoyed his eggs daily, but started experiencing irregular heartbeats. His doctor explained that certain compounds in eggs could interfere with how digoxin works, potentially altering its effectiveness. After adjusting his diet to reduce egg consumption, Alan's heart rhythm improved, showing that even everyday foods can impact the efficacy of heart medications like digoxin. Number 2, immunosuppressant. Emma, a 50-year-old librarian from Washington, was on immunosuppressants following a kidney transplant. Her doctors advised her to avoid eggs, particularly raw or undercooked ones, to reduce the risk of foodborne illnesses that could be dangerous with a suppressed immune system. Emma followed this advice strictly, which helped her maintain her health post-transplant. When on immunosuppressants, it's crucial to be mindful of foods that can pose additional health risks. Number 1, anti-seizure medication. Kevin, a 30-year-old IT specialist from New Jersey, was on anti-seizure medications for epilepsy. Despite taking his medication as prescribed, he continued to have seizures. His neurologist suggested he reduce his intake of high-fat foods, including eggs, which can affect how the medication is absorbed. Kevin noticed a significant improvement in seizure control after making these dietary changes, showing how food choices can directly impact medication effectiveness. And there you have it. If you're taking any of these medications, it's important to talk to your doctor or a dietitian about your diet to ensure you're getting the best possible results from your treatment. Small adjustments, like the timing of your meals or choosing alternative foods, can make a significant difference in your health outcomes. Remember, managing your health is all about making informed choices that work for your body and your lifestyle. Stay informed, take care of your health, and see you in the next video.